Pantoprazole Sodium Vial is used to treat certain stomach and esophagus problems, such as acid reflux. It works by decreasing the amount of acid your stomach makes. This medication relieves symptoms such as heartburn, difficulty swallowing, and cough. It also helps heal acid damage to the stomach and esophagus, prevents ulcers, and may help prevent cancer of the esophagus. Pantoprazole Sodium Vial belongs to a class of drugs known as proton pump inhibitors, PPIs. The injection form of this drug is used for a short time when you cannot take the medication by mouth. It's best to use this medication at the same time each day. Your doctor will determine the best dosage for you based on your medical condition and response to treatment. Remember to take it at the same time each day. When using Pantoprazole Sodium Vial, it is important to follow your doctor's instructions for the correct dosage and length of treatment. If you are administering this medication at home, make sure to learn how to prepare and use it properly from your healthcare provider. Before using it, check the vial for any particles or discoloration, and do not use it if you notice any. It is also important to learn how to store and dispose of medical supplies safely. Remember to inform your doctor if your condition does not improve or worsens. It is also important to ask your doctor about the duration of treatment with this medication. Some common side effects of Pantoprazole Sodium Vial may include headache, diarrhea, redness, pain, or swelling at the injection site. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist immediately. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to inform your doctor right away if you experience any serious side effects, such as symptoms of a low magnesium blood level, signs of lupus, or a severe intestinal condition due to a bacteria called C. difficile. If you notice symptoms such as persistent diarrhea, abdominal or stomach pain, or blood/mucus in your stool, it's important to seek medical attention. In the rare event of a serious allergic reaction to this drug, it's important to seek medical help immediately. Symptoms of a serious allergic reaction may include fever, rash, swelling, severe dizziness, trouble breathing, or signs of kidney problems. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you have concerns about side effects, it's important to discuss them with your healthcare provider. Before using pantoprazole, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication may contain inactive ingredients that could cause allergic reactions, so make sure to have a conversation with your pharmacist for more details. It's also important to talk to your doctor or pharmacist about your medical history, especially if you have liver disease or a lack of certain minerals in the body, such as zinc, or if you have lupus. If you experience symptoms like heartburn with lightheadedness, sweating, or dizziness, or if you have chest, jaw, arm, or shoulder pain, especially with shortness of breath or unusual sweating, or unexplained weight loss, it's important to seek medical help right away. Additionally, before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Proton pump inhibitors like pantoprazole may increase the risk of bone fractures, especially with longer use, higher doses, and in older adults. It's important to discuss ways to prevent bone loss and fractures with your doctor, such as taking calcium and vitamin D supplements. Older adults may be more sensitive to the side effects of this drug, especially bone loss and fractures, and C. difficile infection. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, and if you are breastfeeding, consult your doctor before doing so. It's important to be aware that pantoprazole sodium vial may interact with other medications, affecting how they work and potentially leading to serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products, like methotrexate, may interact with pantoprazole, especially during high-dose treatment. Additionally, some products require stomach acid to be properly absorbed by the body, and since pantoprazole decreases stomach acid, it may affect how well these products work. This includes medications like ampicillin, atazanavir, erlotinib, and others. It's also important to note that pantoprazole may interfere with certain lab tests, potentially causing false results. Make sure that the lab personnel and all your doctors are aware that you are taking this medication. Always follow your doctor's guidance and do not start, stop, or change the dosage of any medicines without their approval. If you or someone else has taken too much pantoprazole sodium vial and are experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, you can call your provincial poison control center. It is important to not share this medication with others. Your doctor may conduct lab and/or medical tests to monitor your condition while you are using this medication, such as a magnesium blood test. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of pantoprazole sodium vial, take it as soon as you remember. If it's almost time for your next dose, then skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing pantoprazole sodium vial, it's important to keep the vials at room temperature, away from light and moisture. Remember not to store them in the bathroom, and always keep all medications out of reach of children and pets. When it comes to disposal, do not flush the medication down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal when the product is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.